Cushing's syndrome. Definition: a metabolic disorder caused by overproduction of corticosteroid hormones by the adrenal cortex and often involving obesity and high blood pressure. Etiology: ACTH-dependent disease, pituitary-dependent ectopic ACTH-producing tumors, ACTH administration. Non-ACTH-dependent causes: adrenal adenomas, adrenal carcinomas, glucocorticoid administration, exogenous, iatrogenic causes, prolonged use of glucocorticoids, others alcohol-induced pseudo-Cushing's syndrome. Risk factors: Cushing's syndrome is more commonly diagnosed in females than in males. It also appears to be more common in the age group of 25 to 40. Other factors which may increase a person's risk of Cushing's syndrome include obesity, type 2 diabetes and poorly regulated blood glucose levels, blood sugar and hypertension. The taking of corticosteroid medications, long-term use. Pituitary gland tumors. A primary adrenal gland disease or benign nodular enlargements of the adrenal glands. An ectopic ACTH-secreting tumor, a growth that forms on an organ in the body that does not normally produce ACTH, a hormone that regulates cortisol levels. Clinical features: pigmentation occurs only with ACTH-dependent causes. A Cushingoid appearance can be caused by excess alcohol consumption. Pseudo-Cushing's syndrome. The pathophysiology is poorly understood. Hyperkalemia due to the mineralocorticoid activity of cortisol is common with ectopic ACTH secretion. Impaired glucose tolerance or frank diabetes are common, especially in the ectopic ACTH syndrome. Increased hepatic gluconeogenesis and insulin resistance can cause impaired glucose tolerance. Overt diabetes mellitus. Hypercortisolism promotes the deposition of adipose tissue in characteristic sites, notably the upper face, producing the typical moon faces, the interscapular area, producing tape, buffalo hump, fat pads, and the mesenteric bed. Muscle weakness and fatigability, osteoporosis, broad violaceous cutaneous striae, and easy get bruised. The face appears plethoric, even in the absence of any increase in red blood cell concentration. Hypertension. Emotional changes, severe depression, confusion, or even frank psychosis. In women, acne, hirsutism, and oligomenorrhea or amenorrhea. Diagnosis: adrenal CT or MRI scan. Adrenal adenomas and carcinomas causing Cushing's syndrome are relatively large and always detectable by CT scan. Pituitary MRI. A pituitary adenoma may be seen, but the adenoma is often small and not visible in a significant proportion of cases. Plasma potassium levels. Hyperkalemia is common with ectopic ACTH secretion. High-dose dexamethasone test. Failure of significant plasma cortisol suppression suggests an ectopic source of ACTH or an adrenal tumor. Plasma ACTH levels. Low or undetectable ACTH levels, less than 10 nanograms per liter, on 2 or more occasions are a reliable indicator of non-ACTH dependent disease. CRH test. An exaggerated ACTH and cortisol response to exogenous CRH suggests pituitary-dependent Cushing's disease, as ectopic sources rarely respond. Chest X-ray is mandatory to look for a carcinoma of the bronchus or a bronchial carcinoid. Treatment. Transspheroidal removal of the tumor, external pituitary irradiation. Medical therapy to reduce ACTH, bilateral adrenalectomy.